it's not a spot check.
Right.
So you're not going to come in and get this test done and it be just what's floating around in the blood. It's actually going to look at what you've been nutrient deficient in for a period of time, correct?
Yeah, and that's what you make a really good point about, is if you go in and get a standard blood test at, normal labs, you're going to get a serum analysis. We are doing the only intracellular analysis. We are actually doing, it's an in vitro challenge where we're taking the T lymphocytes, which are in the white blood cells, out of the sample that's given at Dr. Thomas's office. So you're going to give whole blood when you go in there. And we're going to centrifuge and spin that. We're based in Houston, Texas. We're the only lab who does this. When we stress those cells to grow, we are looking for a percentile of rate of growth to be expected. If your body cannot perform, or if those cells do not perform, you understand that you're going to be insufficient. But the T lymphocyte has got a lifespan of about 4 to 6 months. So it's much longer than anything else out there. If you were to go get a blood test, what your body or what you ate the night before, even maybe perhaps what you have eaten for breakfast, would have influenced what the values are for you. This is truly not going to be confounding. It's not going to intercede, and it's not going to get in the way of giving you some values that are true, because that lifespan of the T lymphocyte is 4 to 6 months.
So the intracellular, and it's really important for our listeners to know that that is the best test. This is the only testing out there that's offered that actually looks at the intracellular component of what nutrients you're actually deficient in and how important it is to know this. Vitamins and minerals play such a large role in our bodies, and oftentimes we'll see fatigue alone. We had talked before the show just about B12 and how it's a common nutrient deficiency, but taking too much B12 or even taking the wrong B12, Kristen, it drives me crazy, and we've had lots of talks about this, about pick up your vitamin supplement and look at the form of B12 that is in that supplement. And most of the over-the-counter, I don't know if I've ever seen an over-the-counter that actually has that active form of B12 in it. So people are out there consuming these vitamins that they may not be nutrient deficient in. It may not be their problem, but they're searching for answers to cure these common symptoms that they're having of fatigue, sleep problems at nighttime, waking up at 3 o'clock in the morning every single morning, or even waking up and having that foggy brain. But in marketing, you see, go take some B12, you'll feel energy, you'll feel fantastic, you'll lose weight. But oftentimes, and even clinics now are giving these B vitamin shots, which may not ultimately be the answer to everything.
And a lot of these clinics have the B vitamin shots that will contain a folate in it that is the folic acid. It's the synthetic form. And it's not the actual methylfolate. And methylation is super, super important, we're finding. We can test for a couple of different genetic SNPs, the 677 and the 1298. And basically, if you have the wrong copies of these genetic mutations, you can have real problems with sleep. You have serious issues with mood and depression. You have problems losing weight. Cardiovascular incidents and risk factors rise, especially elevated homocysteine, which is the toxic amino acid that isn't properly metabolized, because if you're taking either synthetic forms or forms that you are not able to convert based on your SNPs, they're called single nucleotide polymorphisms, based on this genetic predisposition, you are doing yourself damage. But unless you test for these things, you're not going to know. And you're also not going to know that, the grains that you're eating that have folic acid in it is actually doing you a lot of damage. It's another reason to avoid gluten and grains that are out there.